always use three important tools when I show a patient the evidence whether they have good occlusion. I personally call them my three sacred tools. First is a tool called baseball, a U-shaped crown with ear rods, and it is put on you like the earpiece of stethoscope. Its function is transfer functional and aesthetic components from the mouth to another tool called dental articulator. This dental articulator allows the dentist to diagnose if an occlusion has a leverage and whether the hinge axis of jaw joint shifts or shakes during chewing or grinding. In this examination, have to take an imprint of teeth contact or seat wax is most important because occlusion always have to be in harmony with the hinge axis of jaw joint. It means that when chewing, the hinge axis of jaw joint should only rotate
こういう
but doesn't shift or
ガチャ
shake.
ガチャガチャガチャいうようなです
If
ね、
it shifts or
そういう
shakes,
動き
the
が、起
leverage
こってき
will
ます。こ
eventually
れはどうして
cause
こうい
jaw
う動きが
joint
起こってくるか
disorder.
と言いますと、
That's rightly
先ほどお話ししたよ
higher
うに、
molar
ここ
tooth,
の2箇所
even
が
by
シーソー
just
の支
few
点になってですね、こ
millimeters,
ちらの
acts
当たって
like
ないと
the
ころ
fulcrum
と、
of
こ
seesaw.
の関節とでこういう
This
シ
can
ー
cause
ソー現象が
progressive
起き
gum
てきま
disease
す。
or teeth fracture
ですので、
that may
こういう
lead
ガチャ
to
ガチャ、まっ
tooth
すぐ噛んだ時に
extraction.
こうガチャガチャしていくという
Therefore,
ような
we
感
have
じ
to
なんです
take
けど
an
も、
imprint of
で、
teeth
顎
contact
ってい
or
うの
seat
は
wax to
まっすぐ噛んだ
determine
時に
whether
も
the
こうい
hinge
うふうに、
axis of jaw joint
ガチャガチャ
only
と動いてい
rotates
てはいけ
and
ません
not
し、ま
even
た
a
顎
bit
が
of
前、
shifting or
左に動いた
shaking.
時にも
Can you remember the instructions from your dentist when he took an imprint to check your occlusion? To help you remember, you can choose from the list below. 1. Did your dentist ask you to open and close your mouth like you normally do while using impression material? 2. Did the dentist instruct you to bite firmly on a sheet of wax? 3. Did the dentist instruct you to relax your lower jaw? Then they gently guided your lower jaw as you are closing your mouth until your upper and lower teeth got in contact with seat wax. If it was 1 or 2, your occlusion was determined based only by your habitual position or your gut feeling. If it was 3, your occlusion was determined based on the condition of the hinge axis of jaw joint. Finally, your occlusion harmonizes with the hinge axis of your jaw joint. If it was 3, it is better to take 3 seat wax imprints of teeth contact because if it's only 1 or 2 imprints, there is no way to confirm its accuracy. But if there are 3, at least 2 are the same, and this will show the real occlusion. One misconception, even by many ordinary dentists, is that teeth alignment and teeth contact are one and the same thing, but actually they are not. Often the dentist checks your teeth alignment by asking you to make teeth imprints by biting on a seed wax or impression material. From there, they conduct their treatment. However, they don't check leverage or seesaw movement with the three sacred tools I call, which occur during eating meals and grinding at night in your daily life. Perhaps they haven't fully appreciated the impact of teeth contact and TMJ movement on the overall dental health. That's why many cases of this problem remain unchecked. But the reality is tooth contact or occlusion is like dentistry itself. Because if you have bad occlusion, the more you chew and grind your teeth, the more your teeth and jaw joint will be damaged. Unfortunately, this is not yet a widely recognized area of dental health. And quite often, teeth contact is determined only by your gut feeling and alignment of your front teeth, though. People usually cannot notice some types of bad occlusion. Improving the alignment of bad front teeth as shown doesn't mean improving the teeth contact. Thank you for watching this video.
僕は森を手にクジラを取りに行くいつもその海は静まり